Hi everyone, and thanks for attending this webinar today. Today we're going to provide you an overview of your health and safety obligations and what you need to consider when you're looking to return to work as we start to transition into Alert Level 3 next week. The situation is evolving on a daily basis, as you know. As well as the considerations we'll cover today, we recommend businesses engage with their industry bodies to ensure they keep up to date with the latest guidance. Olivia Lund is a partner in our Wellington litigation team, and she specialises in health and safety and employment. I'm the Senior Solicitor in the team. Today we're going to cover the Alert Level 3 requirements and some golden rules for businesses to follow, the requirements under the Health and Safety at Work Act and what the Ministry of Health is requiring, considerations for preparing for your return to work, what a COVID-19 health and safety plan should look like, managing actual or suspected exposure of a worker to COVID-19, your obligations to workers who are still working from home, and WorkSafe's approach going into Level 3. The session will be recorded and will be available to you after the webinar. You can send any questions through using the question and answer tab on the side, and we'll get to those at the end of the presentation. I'll now hand it over to Olivia to get started on discussing some of the requirements we have.
Thanks, Caitlin. I don't know about the people online, but I myself have been overwhelmed by the amount of information and guidance available for businesses that are operating in COVID-19. So, as Caitlin has said, the purpose of today is really to give an overview of the health and safety requirements for operating at Alert Level 3. And to act as a kind of checklist for the things that businesses should be thinking about and doing to get their business ready and safe to operate at Level 3. Many of the principles I will discuss today will likely apply to businesses operating at Level 2 and also Level 3 when COVID-19 is still a risk. So all the information and content has been obtained from publicly available sources, WorkSafe New Zealand, Ministry of Health and other government websites that WorkSafe has effectively sanctioned by directing people to those websites. As Caitlin has said, the advice is high level. There's a lot of work being done by a number of industry groups and sector organisations who are currently in the process of preparing specific guidance and standards that would apply to those sectors. CHASANZ, the Construction Health and Safety Association of New Zealand, has released protocols and standards for the construction sector. There are also a number of other associations, Master Plumbers, Master Builders, and Hospitality NZ is working with WorkSafe and MB to develop guidance for food retailers. So some of that information has been released and is publicly available. There will be more to come in the next few days. So my recommendation is to start preparing now, and you can use the information that is in this presentation and what is already available to help you develop a system. But there will be further guidance and support available later in the week, particularly specific advice relating to your sector or industry. Don't be afraid to seek help from professional health and safety experts if you need it. You can find suitable people under the Health and Safety Association of New Zealand register. So turning now to the presentation and what we will cover. So Caitlin has set out there already at the start what we will cover. Essentially, what I'm going to cover is the Alert Level 3 requirements, and that is what has been set out in the official COVID-19 guidance. We'll then move on to what the Health and Safety at Work Act and Ministry of Health obligations are, and then move through to, well, what do you need to do to plan and prepare to return to work? And that involves having a COVID-19 safety plan and also having a system to manage if workers or anyone else in the workplace is exposed or is suspected to be exposed to COVID-19. So turning now to what the Alert Level 3 guidelines are. So this is taken from the official COVID-19 website, and these are the golden rules that the government is saying applies to businesses that are going to operate in level 3. Now, it's a very detailed slide. I'm not going to read it all out, but the key takeouts are that people should work from home unless that's not possible. So convenience is not going to be a reason to return to the workplace. If people have been working from home up until this point, then they should continue to do that. Businesses can open for business if they are contactless and no customers are allowed on site. But importantly, they can only open if they can operate safely. Now, operating safely means complying with those Alert Level 3 requirements, also complying with the Ministry of Health guidelines, but also fulfilling those general health and safety obligations that apply to their business in the usual circumstances. So the Ministry of Health and Health and Safety at Work requirements are set out on this slide. COVID-19 is a workplace hazard, and PCBUs have a duty to ensure, so far as reasonably practical, that workers aren't exposed to COVID-19. At a minimum, compliance with the Ministry of Health guidelines needs to be implemented. Now, the reason why we're seeing Ministry of Health taking a lead in relation to COVID-19 is because it is an infectious disease. So the Ministry of Health has set out what it says are the key controls that businesses need to put in place to minimise the risk of COVID-19 spreading at work. And they're listed there on the slide: supporting people with flu-like symptoms to self-isolate and not be in the workplace, ensuring that separation distances are complied with. So currently the advice from the government is that in controlled workplaces, that is a 1 metre distance between workers, but if it's outside a controlled environment, then it would be 2 metres. That same social distancing obviously doesn't apply for other sectors such as the health workers. The other key controls are disinfecting services, maintaining good hygiene, particularly hand hygiene, and good coughing and sneeze etiquette. And I'll get onto this later, but keeping records to facilitate contact tracing. In terms of WorkSafe's approach to Alert Level 3, WorkSafe has been very clear that its priority is not under Level 4 being about investigating or taking enforcement action. Their priority has been supporting the government's response to COVID-19 and making sure that organisations have sufficient information and support around how they can eliminate and minimise the risk of people being exposed to COVID-19. So the expectation is that WorkSafe will have the same approach under Level 3 as it did under Level 4. WorkSafe's expectations, which they have listed on their website, are to follow the Ministry of Health advice, promote good hygiene, identify any emerging risks that may come out of your work dealing with COVID-19, and to promote worker obligations. So what should you be doing as a business if you are looking at operating under Alert Level 3? So the first thing is to start planning and preparing for that return to work. So you should be looking at addressing the risks that are associated with COVID-19, but also risks that may arise due to restarting up your operations. So the same approach to risk management applies generally as you are operating as a business. So you need to be identifying the hazards and risks in the workplace, assessing those risks and hazards, and looking at how you are going to manage those risks and implementing controls. So the same hierarchy of controls applies. If you can eliminate exposure to COVID-19, well, then that's what you should be doing. Secondly, you should be isolating workers, and then moving down the list of hierarchy of controls. If you can't eliminate or isolate workers from exposure, well, you should be substituting high risk procedures with lower risk activities, and then looking at engineering measures and administrative controls. Now, there's been a lot of discussion around PPE, personal protective equipment, but that is the last resort in terms of the hierarchy of controls and how businesses should be managing their health and safety obligations. So first of all, an organisation should be looking at, well, what are the risks for us when we go back to restarting? What changes to our work environment and safe work practices do we need to be implementing? And are we confident that we've got health and safety practices in place that are going to keep our own workers safe, but also the families of those workers who they will be going back home to at the end of the day? People should be thinking about, when there is a return to work, have you got the right people doing that work with the right skill set? Is there been any machinery issues or maintenance, that sort of thing that needs to be addressed with restart? The other factor that has been highlighted is licensing and warrant of fitness and that sort of thing, compliance for equipment that needs to be checked. And also, do the workplaces need to be cleaned before staff return to work? So WorkSafe has said that all businesses that operate in Alert Level 3 must have a documented COVID-19 safety plan for their operations. Now, WorkSafe has provided a template for PCBUs to use, and that is what you can see up on the screen there. There is a PDF version and a Word version available on WorkSafe's website. WorkSafe has been very clear, though, that that safety plan is just a template example. So it's not compulsory for organisations to use that safety plan, but it incorporates a number of questions around what organisations should be asking themselves to prepare and plan to operate in Alert Level 3. It's important to, as I've already touched on, to incorporate industry guidance into any COVID-19 safety plans that are being prepared. And importantly, before the safety plan is finalised, organisations should be consulting with health and safety reps in the organisation, but also workers on that safety plan to make sure it's fit for purpose, it's effective and it's efficient. Once that plan has been finalised, obviously you're going to be sharing it with your workers, but also contractors and other people such as suppliers who may come into your workplace. So that is ensuring that you are complying with your overlapping duty requirements. So the COVID-19 safety plan asks a number of questions, but what it needs to cover is what will be done by your business and who inside your business is responsible for the following things. So the first point there is who is going to be responsible for managing those risks from restarting after lockdown. So has that identification process, assessment and control process been looked at, and who's going to do that? Secondly, who within the organisation is going to be providing relevant information and instructions to workers on how to keep themselves safe? So that will include information around the safety plan itself, if there have been any changes to business as usual controls that may be impacted, ensuring that workers and anyone coming to site know what the COVID-19 symptoms are and what they should do if they have any symptoms. Number three, the safety plan should be looking at, well, who is going to be assessing whether workers are well and safe to work, who's going to be responsible for implementing those controls and safe work practices. The plan also needs to, and I'm going to touch on all of these aspects in some more detail as we go through, but who is going to be responsible for managing exposure or suspected exposure to COVID-19. So best practice guidance is that there should be one person who is responsible, particularly for contact tracing, registers, knowing who is coming in and out of the organisation, where people are working and that sort of thing. So if there is an exposure and someone tests positive for COVID-19, or there is a suspected exposure, that process with the Ministry of Health can be managed efficiently and appropriately, so the right information is being shared. Importantly, as with any health and safety system, the safety plan should be reviewed regularly to ensure that the system and the plan that you have got in place is working. And once a bit of time has been embedded and work practices are underway, there may be other risk factors that are identified from business as usual work that are impacted by the safety plan that need changes put in place. So it's important to review the safety plan at the start, throughout your business operations as you're moving through alert level 3 and also to the lower alert levels. So physical distancing is one of the key controls used to either eliminate or minimise exposure to COVID-19. Physical distancing there on the website is they're the recommendations that WorkSafe say. So isolate workers whose tasks can be done alone. So you'll be looking, what is the business, what is our undertaking, what is the work that we do? Can you isolate those workers from others? But you also need to be mindful that by isolating workers from others in the usual way that they work, they then may be in a new work environment. So there will be new risks that will result by isolating those workers and doing it in a different work environment. You need to limit or eliminate the physical interaction between workers where you can, and particularly customers under alert level 3. Practical things that you can do to minimise workers having contact with each other is using barriers in the workplace. So they might be plastic sheets, they may be partitions or dividers that can limit workers coming into contact with each other. There's also recommendations around whether you can reduce contact within different parts of the business. So if you can limit workers into smaller groups and bubbles within the workplace that they only have contact within their group that they need to, then that should carry on for the whole alert level 3 period. Equally, there should be thought given to whether work times need to be split and also meal breaks and entry and exit points. So you may have staff now working in shifts, and that is to keep those workers in their bubble. So you could look at, rather than having a 9 to 5 work day or whatever your usual work day is, it might be from a 7 to 1 work day and a 1 to 6 work day, and then a 6 to 10 work day, whatever is going to work for you in terms of the needs of your organisation. But WorkSafe and Ministry of Health are saying that that's the sort of things around alternative working arrangements that should be looked at to minimise and reduce exposure to COVID-19. Also the physical distancing, so you should be looking at your sanitary requirements in the workplace. So generally there is usually one restroom or bathroom or facility of where workers can actually wash their hands. If you are looking at containing your workers into a bubble, it may be that you need to provide additional ways that workers can either wash their hands or sanitise their hands within their workspace, rather than having everyone going to use the same bathroom or restroom. And equally, there are suggestions around how you might manage the bathroom use, having signs up to make sure that there is only one person in there at a time, and perhaps there is some sort of scheduling or regularity as to when people should be practicing good hygiene, washing their hands, prompts and that sort of thing. Another key thing that organisations are going to have to work through is determining and having a system in place to make sure that their workers coming to work are well and that they are safe to work. So on this slide, I've got up there, well, what are the symptoms, and do workers know what the COVID-19 symptoms are? So that is a key piece of information that all workers and others coming to the workplace need to be made aware of. I'm not going to read them out. Hopefully everyone will know what they are, but there is a lot of discussion and work going on as to what sort of system an organisation should have in place to check workers' wellbeing and health. Some people are adopting self-checks and declarations, which they are requiring their workers to complete on a daily basis. So before they turn up to site, there's kind of a health questionnaire, a checklist that they have to go through, which will ask them whether they've got any symptoms or if they've had any contact with anyone that may be at risk. So that's another thing that organisations will need to work through, and having a system to check all our workers well and safe to work before they come to work, and making sure that they are aware of those COVID-19 symptoms. Other guidance that has been provided by WorkSafe is actually having flexible leave entitlements to staff. So there will be human and behavioural aspects as to why someone who might be showing symptoms of COVID-19 might decide, well, to downplay them or hide them because they need to go to work to earn a living or they need the money. So that may be a driver. So if the organisation has got a flexible leave entitlement policy, and it may be that special sick leave is provided, or the essential workers leave support payment is provided, or annual leave is provided if they don't have any sick leave, that they can take that instead. And that is to incentivise workers not to come to work if they are showing symptoms. So in terms of, I've already talked about the information and instruction to workers, but this is a key thing that organisations need to be looking at. So don't assume that workers know what to do. You need to be providing information to your workers around what are those COVID-19 symptoms. You need to be sharing your safety plan with workers, contractors and suppliers before the work starts, but also look at providing information sheets and signage to remind workers in the workplace, well, what are the physical distancing requirements that are in place? What are the hygiene protocols? Another factor that organisations should think about is, well, what are the hygiene measures that your organisation is going to recommend when people return home to their bubble? So things to think about are making sure that they wash their hands on return, depending on the organisation that they work with and how much potential exposure they may have to COVID-19. It may be that they immediately change their clothes and put the clothes in the wash and have no other people handle that clothing. So all of those sorts of things need to be considered from your business and your risk level as to how much contact your workers potentially are having with others that may be exposed to COVID-19. Importantly, just like with any business as usual, you need to consider the language barriers. So if you have a workforce that English is not their first language, you need to be thinking about ways that you can communicate and provide adequate information and instruction to those workers about all the things that you are providing in English. So the safety plan, the physical distancing, the hygiene protocols, and coming up with a way to check that actually there is an understanding and it's clear that those workers, where English is not a first language for them, that they understand what their obligations are in the workplace and what the requirements for them are. So despite all the best efforts, it's still possible that a worker or someone else in your workplace may show signs of COVID-19, and this could happen while they're at work, or it could happen when they're outside work, when they have interacted with others. So there will be obviously a time delay between when workers have symptoms and they are developed, and the testing and then getting results. And in most cases, what we are seeing is that when tests are carried out, people don't have COVID-19. So unless you are advised otherwise, you can continue to operate, but the plan needs to ensure, which is set out on the slide there, what happens if there is an exposure. So if you have a positive case of COVID-19 from one of your workers who's been in the workplace, or a suspected exposure. So the first thing that you need to do is workers who are unwell, particularly with respiratory symptoms, they should go home immediately and they should call Healthline or their GP. Workers with respiratory symptoms who have had a COVID-19 test should stay at home until they're symptom-free for 24 hours. If you have a worker who has tested positive and you are contacted by the health unit, you can provide information about the worker's contacts at work, and that is for contact tracing. But you shouldn't contact the health unit first. They will contact you and they will provide advice to you about what further actions you need to take in the circumstances to manage the exposure and that positive case that you have. We recommend that you appoint one person within your workplace who is best placed to liaise with the public health unit if they call, and this is something that you need to deal with. The work area of where that worker has been working needs to be disinfected in accordance with the cleaning procedures and Ministry of Health guidelines that you've implemented. And the information that you have about who that worker was in contact with or suspected to be in contact with will help the health authorities in terms of contact tracing. So you need to have a system in place for that. And the minimum information that you will need to provide to the health authorities when they call you is you need to have the full name of your worker, a contact telephone number, you need to have the address or the name of the visitor's business if it's a worker from someone else who has tested positive but has come to your workplace, the reasons for their visits. How you collect this information is up to you, but you need to make sure that a register is being used and it is maintained correctly. So for your own staff, you may be looking at in the next week or so, if you are returning to work in Alert Level 3, that you have got all the personal information and details relating to those workers up to date. So you can check that you've got correct contact phone numbers, emails, residential addresses, all of those sorts of things. So you can be confident that if there is a positive case and you are required to provide that information, that it is correct, because it will be more difficult to get that information afterwards. The recommendations around having a register in place is that you need to be thinking about, well, where is it going to be located? Is it a physical register? Is it an electronic register? Who's the best person to manage that register to make sure that the entries are correct? And can you, once again, divide your workplaces into zones that then limit the movement between the zones? So if you've got one workplace and you've got potentially 50 people coming into that workplace through one entry and exit, but then they are moving around the workplace, all of those 50 people obviously will be possible contacts and will be part of that contact tracing. So if you can minimise the contact between the people in your organisation, then there will be less contact tracing that needs to be carried out within your business, and that will have a lesser impact for your organisation. So moving on to working from home. So obviously under Alert Level 3, there will still be a large majority of the workforce that is still working at home. Organisations, PCBUs, have a duty to ensure workers are not put at risk by their work, which includes their work environment at home. So steps need to be taken to eliminate or minimise those risks so far as reasonably practical. Now, when we moved from Alert Level 3 to Alert Level 4, it was very quick, and businesses only had a couple of days to essentially mobilise their workforce and get them set up at home with home office stations and equipment and that sort of thing. So there was a recognition by WorkSafe, which they said look, ideally workers are not going to be set up as well as they could have been if more time was available to organisations. So their advice and recommendation is that people needed to be pragmatic and assist workers in good faith. So if there was equipment, best case equipment that couldn't be provided, then organisations should be looking at, well, what information and guidance can they provide to workers about how to set up their workstations ergonomically and to avoid and minimise exposure to risks and hazards in the workplace. Under Alert Level 3, there is guidance to say that businesses can redistribute office equipment to workers' homes, but delivery needs to, of course, follow the physical distancing and hygiene expectations. So our recommendation to businesses now is actually to reassess if you've got a large proportion of your workforce at home. You should be doing a stock take to say, well, how is your workstation? We don't know how long we're going to be in Alert Level 3 or even Alert Level 2, which may require staff to be working from home. So recheck in with your staff, reassess the risks, what is their home office setup like, and see what sort of additional support can be provided now that we have moved down to Alert Level 3. The steps that an organisation needs to take to eliminate or minimise risks in a worker's home is limited so far as reasonably practical. And when we determine what is reasonably practical, it generally looks at, well, what level of control and influence do you have over your workers' environment at home? You're not going to have, the business is not going to have the same level of control of a worker at home as they would otherwise have in the workplace. On the slide, I've got some common examples. These are not all of them that would apply, but these are common hazards and risks for workers working at home. So the key one is around the workstation and setup, particularly if we're going to be working from home for a sustained period. Organisations should be looking at what they can do to assist their workers with their workstation and setup. Electrical equipment obviously gives rise to the risk of electrocution, slips, trips and falls. So information and instruction to workers working from home on, one, how they do their work setup, two, how they manage the electrical equipment, all of those sorts of things should be provided to those workers. There's also psychosocial risks from working from home that people should start to think about and implement. So if you've got workers who are in isolation or lone working, the way their job is designed, but also workload. And there'll be a number of other factors from workers working from home, their work environment, that they wouldn't otherwise have in the workplace. So having their family, their children in their home bubble is going to create additional demands and stress that otherwise wouldn't be present. So these are factors that employers and organisations need to look at as to, well, how can they assist workers in terms of managing those psychosocial harms, so stress, fatigue, overload that might happen. And again, that is information and instruction, providing guidance to workers about what they can do to manage that. So regular breaks, going outside for exercise, seeking support if they need it, connecting with family and friends. So on the slide there, I have put up there the government health and safety lead working from home guidance. This is quite detailed guidance, but it is sanctioned by WorkSafe. So WorkSafe have linked to this to say, well, this is a good example and best practice as to how organisations should be supporting their workers to work from home. The guide talks about privacy and security issues as well, which are factors that organisations should be looking at from a risk management perspective anyway, but there is some really good practical advice in there about how an organisation can manage the health and safety risks for those workers working from home. And that's available free online. If you just Google the Government Health and Safety Lead guidance for working from home, it will come up. So that is all the content that I wanted to discuss today, but we've got a lot of time for questions. So I'm going to hand over to Caitlin to start those. But what I wanted to say just before I hand over is that don't do this on your own. So now is the time for collaboration and coordinating approaches. The concept that has been said that we're all in this together is essentially the same as that overlapping duty requirement in the health and safety context. So organisations should be consulting, cooperating and coordinating their safety approaches to COVID-19, not only to assure that the system that you've got in place is effective, but also that it's efficient and people are sharing that load amongst the different organisations that they are dealing with. So back to you, Caitlin, for questions.
Thanks, Olivia. We've had quite a few questions come in today. Before we dive into those, just want to confirm that the presentation has been recorded and the slides will be made available later. Some of the questions we've had come in are, what will happen if someone's infected at your workplace and then they pass away? Could this lead to a prosecution from WorkSafe? Sorry, Olivia, I think your microphone is muted there.
Sorry about that. So that is always a possibility. So depending on the circumstances, WorkSafe could come into that organisation and investigate and look at whether there have been any health and safety breaches. But WorkSafe has been very clear, particularly under Alert Level 4 and Alert Level 3, that their priority is not on investigating incidents where there have been fatalities and deaths. So obviously the same enforcement tools are available to WorkSafe if there is a fatality, and it is a wait and see situation. I myself have been personally interested to see how the health and safety obligations of organisations are being looked at and enforced. WorkSafe hasn't been taking a lead in this space. It has been as the regulator supporting the Ministry of Health and Government. And I think because it's been a state of emergency, we have seen police taking the lead on those enforcement measures. But as I said, there is those enforcement tools around prosecution are available to WorkSafe, and whether we see once we come down the alert levels, they may open a case. So WorkSafe have got 12 months from the date of a serious harm or a fatality from COVID-19 occurring to decide that they might initiate an investigation and look at whether that organisation has complied with their health and safety obligations. But at this stage, that is not the approach that WorkSafe has said that they are taking.
Thanks, Olivia. We also have someone questioning how useful a health declaration might be when workers might be infectious before they're symptomatic.
Yeah, so that's one of the problems around the delay, and there's not much really you can do with that. Obviously, people will be providing a declaration at that point in time as to whether they are showing symptoms. One of the key things that you might look at is particularly you might want information around, well, is there someone within that person's bubble, their home, who is showing symptoms of COVID-19, or someone else who they may have been in contact with where that worker knows that they have tested positive for COVID-19 or have shown symptoms for COVID-19. So organisations will need to be mindful that workers can only be honest and answer the questions that they are being asked, but some thought around the level of information that your organisation wants about their own situation needs to be considered.
Thanks. We've had quite a few questions in about the contact tracing and the register for that. Some questions being what should be included in it and whether work areas should be detailed in that, and also whether there are any privacy concerns in collecting this information.
Organisations are obligated now, particularly under Alert Level 3, to have that information, so they can provide that if there is a positive case or a suspected case of COVID-19. Workers should be advised that what information is going to be obtained and stored about them, but also that information is only to be used for the specific purpose if there is a positive or suspected case of COVID-19, and where that information and who it would be provided to. So there are exceptions under the Privacy Act, which essentially allow businesses to provide this information to the Ministry of Health as required. So you wouldn't be breaching your employees' privacy obligations, but you need to be mindful that you're only using the information that you are gathering for that purpose around contact tracing. The how you do the register and the information that you need, again, I'll repeat that. So it's their full name, their contact number, their reasons for the visit and how long they are in the workplace. And if you have sectioned off parts of your workplace, well, then you would be keeping that information. So the contact tracing team at the Ministry of Health will work with you and determine, well, who are close contacts, who are direct contacts, who within that information needs to go into self-isolation. So that will depend on all the information that you have in the register, and knowing where your workers and other people who come to your work site, where they are going on your site, and having a clear, good understanding of that. Yeah, that's probably as far as I can take that.
We also have a few questions about what the approach should be where an employer has one or more workers who are classed as vulnerable employees, whether they should be excluded from coming back to the workplace, and if not, how that should be managed with the safety plan. Yeah, so
high risk workers are obviously those who are over 70 years of age, those who are pregnant, and those who have an underlying health condition which makes them at higher risk in terms of if they are exposed or contract COVID-19. So they are what we determine are vulnerable workers. So there are a number of things that an employer can do to support a vulnerable worker. Under Alert Level 3, the guidance is those vulnerable workers shouldn't be returning to work. There is an essential workers leave support payment that is available for those workers who essentially are being directed under Alert Level 3 to remain at home and not return to the workplace. And that's the same essentially as the wage subsidy. So it's a subsidy that's available for the employer to provide, to apply for on behalf of that worker. And it's $585 per full-time employee or $350 per part-time employee. The application is made on behalf of the employee. It's for a period of 4 weeks, and multiple applications can be provided. So if we are, say, in Alert Level 3 for a sustained period longer than 2 weeks or 4 weeks, you can make applications to essentially cover that whole time that that worker is not able to return to the workplace. There are a number of obligations, obviously, that need to be met in terms of qualifying for that essential workers support leave payment. Best endeavours need to be made to pay that worker 80% of their normal pay, and the wage support payment is essentially used to pay that worker because they can't otherwise return to the workplace.
Thanks. We've also had a few questions in about the practicalities of meeting the increased cleaning required, including whether or not you can let cleaners in earlier than Level 3 to prepare the workplace, And if cleaners can't go in, who should be responsible for sanitising surfaces?
Yeah, so the guidance is unclear around that. So my understanding is there is government guidance that has said people can return to their workplace essentially to set up and prepare to be able to open under alert level 3. I haven't seen any guidance around whether you can have external cleaning contractors come in to essentially set up your workplace to do that. My recommendation is the cleaning should be in place before workers return to the workplace. So that is going to be something that the business or organisation will need to manage and consider in terms of, well, actually, how are we going to get our workplace into a state that it's safe and suitable for our workers to return to work. So it might be that there's a bit of delay and that not everyone can start operating from midnight on Monday night or Tuesday morning as you would otherwise.
Thanks. We've also had a question in as to whether employers can require their workers to return to the workplace once we are in level 3.
Yeah, so this has been a question that we've been asked, particularly with alert level 4, so essential workers. So understandably, there will be some workers who are nervous and anxious about returning to the workplace. So how you should deal with that is first having a conversation. Well, what are the reasons why that worker is not comfortable returning to the workplace? And this is to check, do they have any health and safety concerns, or do they have any underlying health conditions or concerns that they have about being exposed to COVID-19 that should be taken into consideration. The one thing that I didn't mention before about the essential workers leave support payment is that workers will also be eligible for that if they have a vulnerable or at-risk person within their household. So if there is someone in the household, say the worker is otherwise fit for work and they're not vulnerable themselves, but they have someone who is over 70, underlying medical conditions, or is pregnant, and there's a higher risk that if they contracted COVID-19, well, then they're eligible as well. So if you've got a worker who is otherwise fit saying, I don't want to return to work, you need to ask them what are the reasons why. If it's health and safety concerns, you're obligated to consult with them and try and resolve those issues. If it's someone in their household that they are vulnerable, then you might look at alternatives, so the essential workers support leave payment, or are there other leave entitlements that could be provided for that worker, such as annual leave, unpaid leave. If so, your organisation is able to operate and that worker doesn't have a valid reason for not returning to work, it would be fair for that employer to deal with that as a disciplinary matter. So essentially, they are directed to return to work if you are meeting all your health and safety requirements and they don't have a valid reason, then it is a disciplinary matter.
Thanks. We've had another query in regarding the numbers of people that might show up, for instance, to pick up contactless deliveries, where gatherings like weddings and funerals are limited to 10. What are your obligations around trying to keep that number down?
Yeah, my understanding is Hospitality New Zealand is working with MB and WorkSafe around guidance for food retailers. So hopefully that guidance will be released in the next day or two. But I suspect that is a real risk that is going to occur. And it will depend on the workplace. So as we saw with the supermarkets, they would have distancing between people lining up to pick up their deliveries. So the system that the organisation has in place for pickup is going to need to factor in, well, how's that going to work, and be realistic around actually there may be an increased number of people outside your premise if you are picking up takeaways or food or what have you. How are you then going to manage those workers so that they have the social distancing? So that would be 2 metres between each person, but also that you're not creating additional risk by having a number of people outside your premises that then exposes them to being risked by cars or what have you, depending on what your working environment is. So not a clear answer, but it's something that organisations will need to think about, particularly as we come out of alert level 4 into alert level 3. There'll be, I think, a flurry of activity around that.
Thanks. Just some more questions on the register of workers. We've had some queries as to what extent of information you can ask for. So whether you can ask them to give details about who's in their bubble or who they've recently seen. And another question as to whether cafe businesses have to record everyone who comes to do a contactless delivery.
Yeah, the level of information about, so the first question, so employees, how much information you want to know about their household and bubble. It may not be necessary to meet your requirements around contact tracing for your premise and your workplace and your organisation to know what every single worker is doing. So that may be too onerous on an organisation to have that information and going too far. But if you have a case where someone tests positive for COVID-19 in your workplace, those bubbles will be essentially close contact, so they will then become part of that contact tracing. So I think at a minimum you need to know who is coming into your workplace. You need to have all contact information for your workers. Potentially it doesn't extend so far as to what each bubble looks like, who's in that bubble, whether they are working and who they are being exposed to. I think it should just be limited to your workers in your workplace. But being mindful that if you do have a positive case, then it's going to be going much wider and it will include those people who are in the bubble. In terms of the register for hospitality or cafes and that sort of thing, you should be, so this is an overlapping duty requirement. If you have got other businesses and organisations such as suppliers coming to your workplace, you should have details as to who they are, particularly if you don't have a regular delivery person who is delivering supplies for your business. So there should be a conversation and discussion and agreement as between the two organisations as to who's managing that information and sharing that information, so as if you do need to do contact tracing, you've got that information at hand as to what deliveries have been made, who they were made by, what time, were they on the premise, and how did they enter and exit the premise.
Thanks. Regarding contactless deliveries and contactless payments, we've had some questions about what the extent of this is and have had the example of McDonald's drive-thrus using plastic containers to pass an EFTPOS machine over so that there's no contact directly between the customer and the server. Is that sufficient to constitute contactless?
Yeah, there will be a whole bunch of creative solutions that people will come up with in terms of contactless. Yes, but there is equally still risk associated with that practice in terms of putting the EFTPOS machine into a vessel that is then passed on to that person. So I suppose the suggestion in that case is that you would have the EFTPOS machine sitting somewhere where you don't have any contact with it as the business, and then they use that. I think it'll be similar to what we see in the supermarket. So if people have the ability to use PayWave, the use of cash and that sort of thing should be avoided, and it should be all electronic. Yeah, I think it's going to be difficult for some organisations, particularly thinking about how they have their setup for payment. They need to going to have to comply with that 2 metre distancing requirement. and whether practically you can actually do that with your EFTPOS or other payment methods, I don't know. But if you can't do it, the advice from the government is that you can't operate. It needs to be contactless. So essentially what we're going to see is businesses who are set up for online e-commerce and can receive payment online, they should be fine, and customers should be encouraged to make payment online direct.
We've had one question about how to manage employers' overlapping duties when they come into contact with each other. So, for instance, suppliers coming to deliver something at your workplace.
Yeah, so that's similar to the answer to the other question. So the same requirements around business as usual in terms of overlapping duty, the 3 C's apply. You've got to consult, cooperate and coordinate how you're going to manage exposure to COVID-19. So you need to be knowing who's coming into your site, who's doing the deliveries. You will need to be sharing your safety plan potentially with those people, so there's a clear understanding as to the expectations around entry and exit, hygiene protocols, cleaning protocols, if there are any restrictions of when you can receive deliveries or suppliers coming onto your premises. So as a start, there needs to be thought and discussion and agreement with any people who will be coming into your workplace that are not your workers as to how you're going to manage the risks associated with that.
Thanks. We've also had a few questions as to whether an employer can insist that either existing or new employees that they want to bring on have to prove that they don't have COVID-19 before allowing them onto the workplace. Is that reasonable or practical in any way?
So I think the question is can you enforce mandatory testing for COVID-19 before workers start work? I think that would probably be deemed to be unreasonable and unwise. It would depend on the circumstances of that worker. So if they were, a migrant worker or have come from overseas or what have you, then you may have grounds to then require them to undertake a test, but that probably would not be required given the requirements that the government have in place for people who are returning to New Zealand in terms of mandatory quarantine or self-isolation and reporting of symptoms. So I think that would be going too far in terms of requiring your workers to have a test before they can return to work. It would probably be deemed to be something that wasn't reasonable and was unjustified and potentially disadvantaging your workers from returning to work.
Thanks. We've had a question as to whether workers can return under Alert Level 3, where most of the work can be done from home, but there might be some things they want to do maintenance-wise or cleaning-wise before heading into Level 2, and they might open to the public. What are your views on that?
Yeah, so we obviously will get more guidance and advice from the government moving down to Alert Level 2, so that hasn't been updated yet. I suspect as we move further down the risk levels that would be appropriate. Already the advice is that you can return to the workplace under Alert Level 4 to get ready to start operating at Alert Level 3. So my view is that would probably be fine when we get closer to the time in terms of returning to Alert Level 2. But obviously it's only necessary to meet your health and safety obligations, and it would depend on what sort of advice the government has provided around Alert Level 2 and what's allowed.
Thanks. So I think we have time for one final question here. And what would you suggest the approach should be if workers aren't following the safety plan that you set out?
So just like any other health and safety policy or requirements that you have in place, so workers themselves have an obligation, obviously under the Health and Safety at Work Act, to keep themselves safe, but make sure that nothing they do exposes another worker or anyone else in the workplace to a risk, and that would be a risk of exposure to COVID-19. So you need to make sure that you are monitoring that your employees are complying with your safety plan, making sure that they understand what their obligations are. And if they're not, or then if they aren't doing what they should be, well, you need to be having a discussion with those employees and potentially warning them that if they are not able to comply with the safety plan, then they will not be able to work during the various alert levels, particularly under alert level 3, where the risk of transmission of COVID-19 is high. So employers and organisations, that will be a key thing that they will need to look at in making sure that workers are doing their part to meet their health and safety obligations as well.
Thanks, Olivia. We have a few more questions that we haven't had time to get to, unfortunately, but please do get in touch if you have any questions. Hopefully there's some useful content in there and it gives you some material to move forward with in your planning in the coming days. As I've said before, the session has been recorded and the presentation and slides will be available for you to access at a later stage.
Right, thanks everyone.